Would you want your doctor to tell you every single detail about the risks of every treatment, say right before he gives you some pills? Or should doctors practice discretion on what they need to inform patients, so that people are not scared off from treatments unnecessarily? Well, these are some of the considerations in the guidelines to be given to doctors on what to tell their patients so that patients are better able to make informed decisions. The guidelines will also help doctors not worry about unfair punishments for omissions and ensure they do not practice defensive medicine. The concerns mounted after a case earlier this year in which a doctor was fined $100,000 for not telling a patient about the side effects of a common injection. The guidelines are one of the recommendations made by a work group tasked with correcting problems faced by the medical profession. To explain more on this, we have Correspondent Joyce Teo. Welcome, Joyce.
Hi.
Joyce, there are a total of 29 recommendations put forth, right? Some of them are about informed consent, and we want to focus on this. What are your thoughts on these recommendations on informed consent?
I think there are clearly problems right now, and it's a good thing that efforts are being made to address them before the trust between the doctor and the patient is further eroded. And it all started from, there were two cases that started this, right?
Yeah.
One from the one that we saw just now about the fine, about 100,000. So the doctors, they were really upset about it because that was the maximum fine, and it was a routine steroid injection, and it was appropriate, and they didn't think that the doctor should be, punished so severely. So it gave rise to this. So with this, right, the recommendations actually called for, on informed consent, actually called for the creation of guidelines for the more common procedures so that, doctors can actually, how best to advise the patient.
The patients. And, these guidelines are also to prevent doctors from what it's called practicing defensive medicine.
Yes.
Can you tell us and explain to us a bit more what does a defensive medicine mean?
Yes.
Yeah.
So, with the case, right, they are afraid that doctors may overload the patient with information or make them sign longer and longer consent forms, just basically give them a lot of information. I think it creates fear in the patient. And defensive medicine is also when you order more tests, procedures, maybe visits than necessary, or you may avoid caring for high-risk patients because you're afraid of being penalized, right, for omissions, right? So the doctors are saying, because in medicine is not an exact science, right? I mean, it's not always 100%, things do happen, and if the doctor is afraid of being sued and worried about being sued, right, and he does not trust the disciplinary system, right, he may act defensively.
Right. And of course, Joyce, 29 recommendations, that is a lot of recommendations. Of all of them, which are the ones that you would say patients need to sit up and take notice of?
Okay, they're all, I think it should be taken as a whole, as a package, because they're all meant to benefit the patient in the end, is to strengthen the patient-doctor relationship. So there are various recommendations. Some are they want to set up a new committee, sieve out frivolous complaints. They want to devote separate resources to clear backlog, and the guidelines that we mentioned, they're all in the end to help the patient. It will all benefit the patient because you will trust the doctors more when the doctors trust the system more. So everything will benefit the patient in the end.
So it's really it's rebuilding that trust between patients and doctors, which seems to have been eroded. Right?
Yes, because the case mentioned, right? If you overload the patient because you're worried that you'll be penalized, and then when you overload the patient end up being fearful. And you don't trust the doctor. Then it becomes
very difficult on both sides, both the doctors and patients as well.
So
thank you, Joyce, for coming on to really explain to us on layman terms, exactly what these recommendations entail. Now, for the full report, you can check it out on our website at straitstimes.com.